Congratulations, you've come to the conclusion that FUE, follicular unit extraction, is the right choice for you. Well, that's great, but now you're stuck with a new dilemma. Where are you going to have your FUE procedure performed? Well, there's a lot of different places that perform FUE, and one of the guides that I think patients should use in determining where they feel most comfortable having their FUE procedure performed is thinking of the criteria, the 5 Ps. The first P is the punch, the second P is the pickups, the third is the preservation of the grafts, the fourth is the performance, who's performing the procedure, and 5 is the placement. So what do those mean? I'll break them down in a little more detail. The first P, the punch, and this is probably one of the most critical. Now, in our practice, we use a handheld. I use a handheld oscillating punch. And I like that for a couple reasons. First of all, the handheld motorized punch, there's a natural curvature to the hair beneath the scalp surface. With a handheld, I can account for that in capturing each individual graft. So therefore, I can use a smaller punch and still capture an intact graft. When a robot, for example, just punches straight in and out, in order to account for that curvature, it has to use a larger and larger punch, which ultimately results in more trauma to the skin surface. The second important element is it's oscillating. The fact that the small punch oscillates creates less trauma to the scalp surface, and the oscillating motion, in addition to the fact that it's a trumpet-shaped FUE punch, captures more protective tissue, being able to burrow down beneath the skin surface, beneath the stratum corneum, and attaching or capturing the grafts, an intact graft in that healthy protective tissue, really can make a difference in terms of ultimately having better viability. The more protective tissue you have around the follicle and the stem cell containing portions of the follicle, the better the ultimate growth. So I like to use the handheld oscillating punch. Pickups. Now this seems like a pretty fundamental and simple aspect of the procedure, but it really can make a huge difference. Having forceps that can effectively grip the graft without stripping it of that protective tissue is really critical. Being able to firmly capture the follicle, pull it out intact, generates more healthy grafts in an FUE procedure. In addition, being able to store them as you're picking them up in a type of forceps that ultimately hydrates the surrounding grafts allows for much more efficiency in the harvest, and we can do larger procedures in a more efficient way with better viability. You have to make sure that the grafts are hydrated throughout the procedure. Desiccation or dehydration of the grafts is really the #1 killer of grafts in decreasing growth. So the fact that there are forceps that allow you to hold on to the grafts and they can ultimately hydrate each other with the fluids that are contained within them really makes a big difference in terms of viability. And of course, the next P, preservation of the grafts, is really critical as well. We use a combination of PRP and hypothermosol with ATP. Now, what does all that mean? PRP is your platelet-rich plasma. Whenever anyone comes in, we do a small blood draw, spin that down in a special centrifuge to create their platelet-rich plasma, their PRP. Studies have demonstrated that storing your grafts in PRP can improve the overall growth rate, the overall survival rate of the grafts by a good 20% compared to just normal saline. In addition to that, we also preserve the grafts in a biosynthetic ATP containing medium. Now ATP is adenosine triphosphate. That's what your body produces when you take in oxygen. Your body produces ATP, which is ultimately what your cells need to thrive. Your grafts, when they're undergoing a procedure in our office, your grafts are stored in a biosynthetic ATP, and ultimately they can be placed 72 hours later and they'd still be viable. Now obviously we don't do that, but this is one way of really demonstrating that this type of storage media really can optimize the survival rate of grafts. So preservation is key. Who's performing the procedure? That's really important to find out who's actually going to be performing the harvest when you're undergoing FUE. I perform all of the FUE harvest personally. I'm there capturing each of the grafts. There is someone who's helping pull the grafts and someone who's counting them as well, but I personally perform my own FUE harvest, and it's really important that you as a patient have a good understanding of who's actually going to be performing the procedure. So you don't want to have a bait and switch where there's someone you never met suddenly performing a procedure that's obviously very important to you. And the last critical question is the placement. Who's placing the grafts? I've been working with my team for about 14 years now. Every picture that I show, when I show my before and afters, it's the same team that you'd be working with on the day of your procedure. Also, an important element of the placement process is patients do not need to shave their recipient area. You can come in with your hair at its normal length, and that's not a problem. We're very used to working with hair at long or short lengths. It really doesn't make a difference. We have a lot of female patients who obviously don't want to shave their head. So being able to effectively place in all lengths of hair is a really important thing to find out as well. If you don't want to have to shave the top of your head, make sure you ask the question, do you have to shave the recipient area for the procedure? So in summary, the 5 P's that I think are very important to understand when you're deciding where you want to have your FUE procedure performed are the type of punch, the type of pickups that are used to pull the grafts, the type of preservation media, who's performing the procedure, and who's placing, and how is the placing done, and do you have to present yourself a certain way in order for placing to be optimized. So I hope this is helpful. Good luck with your decision.